This is Guardian Radio, your station for up-to-the-minute news, intelligent, interactive, and engaging conversation. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
Dr. Denotha Archer Cartwright. Thank you for joining us on this Tuesday evening on Guardian Radio 96.9 for all things health, wellness, and things that pertain to the Bahamian Society. Of course, brought to you by Medical Concierge Services for all your medical healthcare needs. We are a family medicine clinic that is located in the Bahamas Art Center. We're open Monday through Friday. And you can give us a call if you need to reach us at 326-1521 or 324010 for WhatsApp. And of course, we are on Facebook and Instagram. And our website is www.mcsfamilymedicine.com. For those of you signing up for NHI, we have a few more spots left. Sign up for NHI, which is, primary health care. You can do so at any of those numbers. And just say you want to sign up for NHI, have your NHI number available, and just some basic information. So you can do that. You can do that for the whole family. We basically see everybody there. We do general practice services, as well as a lot of other things, including IV vitamin therapy, microneedling, and of course, house calls and visits. So give us a call, 326-1521, or our WhatsApp line, 432-4010. Good night, everyone. I'm glad we're all back. And it kind of was off and on for the last few weeks, being very, very busy. It was my grandmother's 100th birthday just last week. So we celebrate, usually when the show is on, that was actually her birthday, so it was August 1st. So we celebrated with her, and that was quite amazing. Amazing woman, Ms. Irma Bullard, never drank or smoked or did anything like that in her life. She was born in Rumkey. So all of you out there that are from Rumkey or have family from Rumkey, we're probably some type of family, because I'm from Rumkey on both sides of my mom's family. So yeah, that was pretty amazing. We got to take her out for a nice dinner, and we had a few different events and things that we got to do with her. So that was really, really excellent. And it kept me pretty busy last week, but we are back to talk about some things tonight. And I'm also going to open the line, since I've been gone for a while, to talk about, ask questions about. I'm quite open to it tonight. So I'm going to have it kind of freely open. The lines with us are 323-6232. 325-4316, and 325-4259. For those of you on social media, you can find me on The Doctor is In with me, Dr. Denotha Archer, on Facebook. And you can also leave comments there if you would like. Today, I'm kind of talking, it's a health topic, but it's also like a social topic. And I want you to think about the healthcare system here in the country. What do you think about it? Do you think that we're doing a good job? Are we heading in the right direction? There's some positives, there's some negatives. What do you think about healthcare? What do we need to do? What would you like to see? Because I think we have the potential to really improve our healthcare. And so I think it's something we need to think about as we're on this journey. You know, there was a lot of talk about being 50 years old and what that meant and everything like that. And I think at some point we have to have some goals to where we want to be in the future. And healthcare is super important. So I want to look at some of the healthcare systems around the world and how do we kind of pair up, like where do we fall in line with healthcare pretty much around the world. And so I looked at a bunch of different articles. And so I wanted to share some of that with you. And, you guys can jump in whenever you want to and tell me what you think about healthcare in the Bahamas, both public and private. When people come into our clinic, they're kind of like pleasantly surprised because we do have a mixture of both um, healthcare and a feel of hospitality. Perhaps because I'm also a concierge physician, I know that hospitality to healthcare. So it feels quite different because I do practice a more patient-centered approach. And so I get a lot of people telling me that they do feel a difference. So how do you feel about healthcare in the Bahamas? Are we doing a good job? What do we need to improve? What do you want for the future? And how quickly should this be done? So I'm going to talk a little bit about the statistics about here in the Bahamas, and then kind of look at what the top 10 healthcare systems look like and how do we match up to all of that. So I saw an article, it just gave me a few of the statistics. It was a little bit older from 2015, but it had kind of the information that kind of put us in a ranking of how we look in terms of healthcare around the world. And so it looked at the fact it was looking at about 2015 when our population was about 388,000. Well, it hasn't grown that much since then. And at the time, the Bahamas ranked 100 by population. So when we looked at all the countries around the world and we ranked them based on highest population to lowest population, we're all the way down in 176 because we have a really, really small population for a country. You know that if you travel, if you go to the United States, there are cities, there are regions, there are small constituencies that are basically bigger than our whole country in terms of numbers. So by population, we're like 176 in the world. And by total area, as in how big we are, the amount of area that we cover, we're about 170th in the world. And so that kind of gives you where we kind of sit in terms of size and where we kind of sit in terms of how big we are. So we are pretty small. But we ranked 94th in the world, though, in terms of healthcare. So that means that even though we're one of the smaller countries and our landmass is small, our countries are small, we were still higher up on the list when it came to actual healthcare. We are looking at competing with a lot of third world countries as well. And so the Bahamas kind of came in a little bit higher than, a lot higher really than a lot of other countries. But, we're number 94th in the world when it came to healthcare. And so the 2014 expenditure at the time on healthcare was about $1,800. So we could average that's about $2,000 a person. And that was about 7.5% of our GDP. It may be around the same amount now. And our life expectancy for men was 73, and for women, it was 79. And they like to look at life expectancy as how well your healthcare, how well your health. With better healthcare, people tend to live longer. So if you are in a lot of these first world countries, you'll see that people have longer lives. I mean, it depends on certain other things, culture and lifestyle as well. But those are the things they kind of look at when they try to determine, is your healthcare system working? And also factored into that would be like quality of life. So you're looking at quality of life, how wealthy the country is, resources, healthcare, all of that kind of rolled into one. Surprisingly, in this document, they said that we had about 2.82 physicians per 1,000 people, which was higher at the time compared to the United States. I'll have to look to see if there's any other statistics on that, but basically we had more doctors, about the same amount or a little bit more doctors per 1,000 people. So you should really find that there should be really great access to health. I would say why you may not be feeling that way would be probably the distribution. And I've talked about this even with my work with government, that the way that the physicians are distributed and the what people are going into or focusing on is part of the reason you may not feel that we have the amount of physicians that we do. And if those resources, those human resources, were distributed differently, and we actually put a focus into certain specialized areas, you would feel the difference. All right, so they go on to talk about the fact that we had 3 public hospitals under the Public Hospital Authority and 55 community clinics, as well as some satellite clinics. Those are run by the Department of Public Health. Then there's 2 smaller private hospitals. And of course, we have, private clinics and those types of things. And that all encompass private hotel, hospitals, emergency, general, and specialized care. So that was kind of the background. They also then, and I think this is what helps to even bring us up today, probably in more recent rankings, is the development of national health insurance, which our clinic is also a part of, which basically kind of gives access and of care to people that may have had to have gone to a public clinic, or may not have insurance, but they want a high quality of care. So that would help us, because it's getting closer to kind of like a universal healthcare system, which when we look at some of these different countries, we have a caller. Caller, you're on the air. Sorry for having you waiting. Caller, are you still there?
Hello?
Yeah, sorry about that. Caller, are you there? Okay, I'm not sure what's going on with the caller.
Hello?
Caller, yes, are you here? Go ahead.
No, Godly Davis talking right along with you, Doc.
Hello.
We need justice, law, and order in Bahamas here. What I want to say to you, right, when you're talking about ranks, I was in 2 hospitals in the United States, Parkway General and and Jackson Memorial. And I was the one clinic, what you would call oh Lord, what's the name of it again? Anyhow, it won't come to me, the name won't come to me right now. But speaking about the hospitals, right? It's a shame for me to say this, and I wouldn't want to say this, but I have to say this now that you asked a question, right? Those who, especially a Parkway General, I mean, it's so clean and you get such decent service, right? Now I know the nurses here in Nassau, to Princess Margaret, and doctors, they try their best, they doing the best they can, right? But I think, from my experience, I think we're way behind, And you said we about 90 something, 90 what?
94th.
94?
94th.
According to the rest of hospitals around the world, I would think we are below 94. Okay?
You have to consider
from my experience right in Parkway General and Jackson Memorial.
Yeah. I think it's because we consider ourselves first world. So for first world,
what you think? I can't hardly hear you.
I'm saying if we consider ourselves first world, then we're low in the ranking. You have to realize that most of the world is considered, and I don't like the word third world, but developing nations, right? So we're amongst the developing nations. For developing nations, we're okay. But if you compare us to what they call nations that are already developed, then you can see
called what?
Nations that are already developed, like United States,
would
be considered a developed nation.
But the thing is, we all, the people here, always prize ourselves us with the United States, and and the thing is, from my experience, we're way behind.
No, definitely. Like I started my studies in Canada, and I think we were way behind for a while, and we probably were getting further and further.
And the same when it comes to keeping the place not smelly here in Nassau, it seems like it seems like that's a problem nobody want to deal with or dealing with.
Well, I really don't know why. I would tell you that, to me, any problem with
Say it again?
I would say anything with our current structure only would take a year or two to fix if we were focused on fixing those problems.
Well, I hope certain places you go, the air conditioning leaking.
Mm-hmm.
It's much to be desired.
Right.
Thank you.
Okay, thank you, sir. Thank you for your comments. So we have one caller. He's not happy. He comparing us to the United States, and definitely he's seeing that comparatively, because we are in a peculiar position as the Bahamas, because we don't really like to be considered a developing nation. We're kind of somewhere in between. But I think we always lean more towards ourselves being a more developed nation. And so that 94 kind of represents that we're kind of in the middle of the bunch. When in the middle of the bunch means that you're at the bottom of the developing nation status type people. So it's not really, it isn't as good as it looks. And especially for a small nation, you would think that it would be very easy to solve our problems because they would require less money, less time, less space. The type of institutions that we have as our primary representations are just like small. So what is holding us back from kind of turning that page and stepping into a more developed healthcare system? I think one of the best things that was done, and I guess it was this government that kind of did it, was NHI, which gave access to the private clinics. Since then, we've kind of trottled along. I know COVID definitely was a bit of a setback, but we had a lot of problems even before then. And we're still looking for those problems to be solved and to be dealt with. I have a comment from online. Good afternoon, Dr. D. Archer. What do you think about age limit for our members of parliament, having them do a cognitive and physical test in order to serve? Well, I would say this, and I don't want to be an ageist because not everybody is the same, but the fact that the public service has for retirement, why is not across the board? I feel. I think it should be across the board, and anybody above that retirement that wants to serve or anything at that point, maybe do a cognitive or physical test. I don't see anything wrong with that, because if you're a public servant, you can't work past a certain age. Usually, even in the private systems, 65, 70 people are kind of like looking for you to retire. And it does a couple of things. It makes space for the younger generation. I think you should be able to get it together by 65. And then it brings new ideas, innovation. And, there are some people that you would not leave as long as they have a job or opportunity. And I think it's making us kind of stagnant in a sense. And I've actually seen people who have been in positions that had cognitive in very high positions, and nobody said anything, and you couldn't really, who would you tell, right? Some of these people are really, really at the top there. So who would you go to afterwards? So it is something to think about. It's something for us to think about as we are living longer as human beings. Like I said, my grandmother is still alive. She's 100. She still has all of her mental faculties, and I think that she can run some stuff better than maybe some of the people that we've got in some of these positions. But definitely, I think there is kind of like a hypocrisy that in our government and private systems, you kind of have a retirement age where we're like, hey, maybe you need to think about wrapping this up. But we don't think about that in terms of politicians. So great comment. And I think that's something that we should look into. I think if there's nothing wrong with you, you shouldn't have a problem, because if you want to drive at the age of 70, they still seeing good and all this stuff like that. They want to know this information. But we put leadership in the hands of just about anybody. We don't even make sure that these people can they read? Do we ask that question? Is that a part of it? I don't even know. So we can all see that our country at some points are not always led by the best of us. And usually the countries that do really well are led by the best of the nation. When you have a situation where it's just like party politics, it's a lot different. So there's where it's at. So we're talking about healthcare in the Bahamas as a system as a whole. And what does that mean? So what is it to have quality healthcare? Well, the World Health Organization says quality of care is the degree to which health services for individuals and populations increase the likelihood of a desired health outcomes. It is based on professional knowledge and is critical for achieving universal health coverage. As countries commit to achieving health for all, it is imperative to carefully consider the quality of care and health services. Quality health can be defined in many ways, but there is a growing acknowledgement that quality healthcare should be effective, providing evidence-based healthcare services to those who need them, safe, avoiding harm to people from whom the care is intended, people-centered, which is an approach that I adapt, providing healthcare that responds to individual preferences, needs, and values. To realize the benefits of quality healthcare, health service must be timely, reducing waiting times and sometimes harmful delays, equitable, in words of providing care that does not vary in quality on account of gender, ethnicity, geography, location, socioeconomic status, integrated, providing care that makes available the full range of health service throughout the life course, and efficient, a word that I like, so effective and efficient, maximizing the benefits of available resources and avoiding waste. And so we would need to have all of those things to have a good quality healthcare system, which I think in pockets we do very well, and in broadly, perhaps we lack some of these things. And that's why I kind of went, more into private practice as I went along, because I think that it's easier to provide some of these things when you can kind of sort this stuff out yourself. So that's effective, safe, people-centered, timely, equitable, integrated, and efficient. And you can join in with us, 323-6232, 325-4259. All right? And then we're going to look at some of the top, and then I'm going to hone into one specifically because they are very similar to us. So we'll look at Singapore's healthcare system and what makes them great. But let's just go through the list of kind of the top countries. Where can you find the best healthcare? Okay, so there's a blog by William Cooper who looked at these top 10 countries in the world and why is it that their countries have really great healthcare. So he talks about being in the third year past being in the pandemic and the emergence of different illnesses and why it's so important to have access to strong healthcare systems in your country, and how different and how widely the difference between healthcare in various countries have become. And when you're moving around, especially in the idea of a global society, what would that look like, and where is the best healthcare if you are kind of moving around? So which countries have the best healthcare in the world? And what he realizes, this has a lot to do also with the quality and efficiencies of the country. And so that relates into the healthcare system. And this has a massive impact on the quality of life of citizens in a country. So good healthcare, quality healthcare really is one of those things that changes the quality of life. And countries around the world apply different approaches to provide public healthcare. So there's no one size fit all, but for varying different reasons, these different countries all have really good, high-ranking healthcare systems. And so the World Health Organization looked at well-functioning healthcare systems, required a steady financing mechanism, a properly trained and adequately paid workforce. So you had to have the correct financing to upkeep the healthcare system. The people had to be properly trained and adequately paid. The facilities have to be well maintained, and there had to be access to reliable information to base decisions on. And this is the evidence-based model that really determines modern healthcare. We have another caller. Caller, you're on the air.
Doc.
Yes.
I call back. The clinic I was to, right, was the unit. And then when you go in there, you would believe you in some type of office, you know. And Jackson and Parkway General, they don't leave you all scarred. They does work like they doing cosmetic work, you know. And I appreciate them for that. But my point is here, as much as our doctors just go away from the Bahamas to get their training, I don't see why when they return they can be given better service. Thank you.
Yes, sir. Yes, sir. Service, I think environment says a lot, but I think he's still in the background. I would say this, right? It's very, very public, whole other kettle of fish, because the work was actually under PHA, and that clinic is probably top tier. It's very close to being like a private clinic. It's close in the public system that you could get. So our clinic was very different. That's where we do a lot of training for the doctors who are training to be specialists like me. And so our clinic is a lot different in a sense because it's a different system running that. And I would say closest thing similarly to a private clinic. I don't know what all the private clinics look like, but I know that when Dr. McCullough came in, who is a heart surgeon in the United States, I don't know, those of you who have been to my private clinic, it's small, it's quaint, it's cute, but it is very, very clean, very, very nice. And I like a modern style too, so it's very like that. And he was really impressed. He said, "Your office is better than my office." And so it really just depends. Like, what do you think is okay? What do you want your office to look like? What do you want your healthcare to look like? What, as us as Bahamians, what are we willing to demand and request, right? Like, because I think it has a lot to do with mindset, and hence why I'm kind of making this move myself out of that system, is because if the mindset is that this is adequate, this is okay, then that's pretty much where you stay. And what you find is in these systems, if you have a different approach, you don't really fit in because everybody is comfortable with status quo. And so I think that is the problem, just people being comfortable with whatever. And that's kind of some of the challenges I would say I would have had in the public care system, was that when you kind of point out like an issue or that is an issue, then everybody kind of looks at you like, oh, why are you making that a problem? Everybody just kind of goes along with that. And so that mentality is kind of across a lot of systems in the country. And it may be because we have the same people just kind of taking up space over so much time. But it's just a culture that is that way. And I don't think that it has to be like that. So really is an individual choice. Like, I didn't go to school in the United States. And I'm probably sure that my office is a lot more refreshing than a lot of people who may have even gone to the United States. I don't know. I don't know what people's offices look like. I don't go into a lot of different clinics. I know some of the newer ones are going to be really, really nice. But, public versus private, public doctors can't really do much about the aesthetics. That's just running the administration of it all. And you come to realize that doctors don't have a lot of power when it comes to that stuff. Not at all. And if they don't have the right people leading them in certain areas, then they don't have any say. And so they may be suffering in that environment just as much as you. All right. So definitely, so 323-6232, 325-4316, 325-4259. What do you think about the healthcare system? Can we be doing better? What do you want to see? What are you comparing it to? And so on this list, so we were talking about what does it take? So you need to have a well-functioning healthcare system. You need it to be properly financed. So you can't, be chasing a debt in the budget. It's got to have the money in place to do the things that you need, because healthcare is extremely expensive. And I was explaining this to a gentleman who was in my clinic, and he was kind of complaining about some government services. And I was telling him, like, it's because it's underfunded, and then people don't pay when they're even supposed to pay. And, you know, if the service is $1,500, if the cost is $1,500, and the government subsidize a big portion of that, let's say they subsidize $1,000, and so now it's only $500 to you. If you don't pay the $500, the cost of the service doesn't change. It's still $1,500, but now there's a deficit. And so if we keep on adding those deficits up over time, there won't be money for to finance things properly. And that's where they're really kind of struggling, is because you want to be an institution, especially if you're using government money, which means that it's taxpayer money, where you want to increase access to care, but you also need to have a financing system that works. And so if you don't collect the money, or you don't have a system to properly pay the money, or you're not using the money efficiently, then you're going to have a problem with your financing mechanism. The next part was a properly trained and adequately paid workforce. I would say possibly that we have probably really well-trained doctors and nurses, because our nurses do really well when they go to the US, and our doctors are really well clinically trained, especially if they go to UE. Pay, you know, it's neither here nor there. I actually was a part of the team that fought for the last really big raise for doctors, so that was better. But you know, it's not on par with the nations that we consider developed. So it's very difficult to get that level of service, even because people aren't kind of like paid what they need to be in a country which is probably 25% more expensive to live in. So something has to be done there. Well-maintained facilities. So you need the money to maintain the facilities, and you have to have a maintenance plan, and you have to have a general idea of what a hospital should look like, what a clinic should look like. And so a lot of that is out of the hands of the physicians, and that's coming from administration, I would say. Access to reliable information and based decisions on. I think that we have a problem with that in the country across the board. There isn't a high, I guess, you know, it doesn't seem important to have the information readily available for people, because people can study this information and make decisions. A lot of our decisions are I guess, you know, made in sometimes vacuums, political, lots of other things. And then we're not sharing the information so that even if you want to make a decision, other people can take a look and say, well, that kind of makes sense, or that doesn't make sense. And so we're all kind of in the dark, and it's not a good thing for when you want to run like a first world. I don't like the word first world, but if you want to run yourself like a properly developed nation. So healthcare is costly. It's a big item on the national budget. I think we spent over $300 million. Which is probably close to about 10% or so of our budget. But are you getting value for money? So the cost, does the cost give you like good value for your money? And are you getting the outcomes that would make sense? So if you're spending a lot on healthcare, but people don't think your healthcare system is good, you're not getting really good outcomes, that's another thing. I don't know if we do a lot of, we should be looking at those things. So the World Health Organization last global report ranked the top 10 at most advanced countries in medicine with the best healthcare in the world. So number one on that list was France, and then it was Italy, San Marino, Andorra, Malta, and not some of the people that you would have expected. So the caller talked about U.S. healthcare. U.S. healthcare is not on this top 10 list. And that's one of the things that I spoke about when a few years ago, was that, you know, we're modeling, because I think we had a lot of influx of doctors coming that went and got trained in the U.S. If we're modeling our system after the U.S. system, the U.S. is not in the top tier when it comes to healthcare. And so you want to model yourself after the best ones, and then you're probably going to fall somewhere just below that. But they are not the best. They are really good and glossy compared to us, because I think they have really good structures and systems in terms of, infrastructure and stuff like that. And then Bahamians have to realize that most Bahamians that are going to like top tier hospitals and they have insurance. So that's the other thing too. I'm not sure about their public hospitals. So you never hear about Bahamians going to a public hospital in the United States. You have insurance or you're coming with a lot of cash. So I think that's where we have to understand, what are you comparing to? Are you comparing our public care to their private healthcare system? That's the other thing as well. Okay. Singapore, who's number 6, and we're going to look a little bit more at Singapore because we want to look at someone comparative. So Singapore has been around just about the same amount of time as us. They kind of got away from colonialization around the same time. They're like an island nation. So they have some similarities to us, but yet they've kind of gone past us in a lot of different places and different systems. And so Singapore is number 6 on the list. Spain comes in at 7, Oman at 8, Austria at 9, and Japan at 10. And we'll kind of look into why are they considered to have the best healthcare. And that's the best healthcare for their populations. And we're going to look at how their citizens actually pay for healthcare a little bit too, and whether it's universal or patient-required healthcare insurance or general standard of care they receive. So France, which is number 1, the French healthcare system is characterized by universal coverage and government organizations. Healthcare in the world, statutory health insurance was expanded to cover over every citizen in 2000, and out-of-pocket payments are common for doctor's appointments, but a lot of this is then refunded or subsidized by the government. So their system is universal coverage. There's some variation of coverage by the government across the board, and everyone basically has to have this statutory health insurance. So everyone has to have like a minimum health insurance that they all have, and some of the out-of-pocket expenses that they may have to spend, there may be ways of getting some of this money refunded. It's ranked top by the World Health Organization through its Mammoth study, and it's scored really well for its health outcomes. So what that meant is that if you, people in the healthcare system tended to get really good outcomes or do really well. So their treatments were working, people were coming out of the hospital alive, they just had like really good outcomes. And it's, so they have some really high quality medical care, some of the best in the world. And France has the lowest levels of cardiovascular mortality in the OECD. So you also have to, when you look at that, you have to look culturally at people and their culture and their fitness. We have a caller. Caller, are you on the air?
Yes, good evening, Dr. Arch. How are you doing?
Hey, how you doing?
Yeah, I'm all right. Bremen remind me of some things. I used to live in the States for a while. I was exposed to these other hospitals. But, Dr. D, that's their question, right? This is from a patient's perspective. You understand me what I'm saying? That's the condition of the healthcare system. And it's all based on a level of consciousness, right? And so when I have a panorama, I think about prevention first, right, Dr. D? To avoid going to the doctors, right? Who are not all are not alike. Some tend to talk down to you. I had one the other night tell me about how with all she learned in school and her degree and all of this and that and way. But I thought it was a form of emergency. I had an infection, right? So I'd taken some antibiotics, and I saw pus after 1 week of this antibiotic, which was 2,000 milligrams a day. And I thought it was a concern because, but I realized it was a localized infection. And so it was an abscess underneath the toe that I got from a pedicure, just moisture, et cetera, et cetera. So it wasn't, and they had to drain it surgically. So I learned a lot of stuff that if it was fungal, it wouldn't have created the pus. A lot of things I learned from them, right? But in being ignorant about some things, if you have an infection and it's persistent, and you know about sepsis, it doesn't matter if it's localized. I wouldn't know all of that until they do an X-ray, but I just thought it was a form of urgency, and she she didn't, the clinic had closed, and so when one show a form of urgency for his own health, how could you knock them for that? So what I'm saying is, of course, the A&E section of the Princess Margaret Hospital, right, Dr. Archer?
Mm-hmm.
They have some isolation. I see some new innovations. They have some new isolation areas where patients are isolated, etc. But where they used to collect the blood bank, where they used to collect the blood samples, not the blood bank, the blood samples, where they used to do the blood testing, there's a little hallway there, and it's very inglorious looking, and you could smell like the little stench, and it's people are on gurneys in close proximity to one another. There isn't much seating. It's a pathogenic paradise, to say the least, or whatever it is, right? And it really made me feel real inglorious and downtrodden. When I step in life, there's nothing. It sends a message to me what the government thinks about us. And people like me have to be allowed to speak. I'm not interested in people who are very ignorant in the medical field or science, that they don't know what to expect. Not to mention the lack of infrastructure. The CAT scan was down. Everything is down, but everybody's around. But it seems to me as if a lot of people are in the healthcare system. They don't really have love for people. It's like we as black people, we hate one another, and we don't deserve healthcare because we don't pay taxes, and some people come in there.
We all pay taxes.
I paid for my X-rays and I paid for whatever was needed. But what I'm saying is, there seems to be like a top-down. I think doctors would learn more if they be more receptive to what patients have to say, knowing that the human body is actually smarter than their degrees, right? And so one would have to be able to articulate that. But as for me, right, assisted suicide would never be off the table. You remember Dr. Jack Kevorkian, right?
Yeah.
All right. So, and you're pretty young, so you have to be a well-read person to really remember Dr. Jack Kevorkian. But I remember Dr. Jack Kevorkian.
I heard of him. Yes.
They used to call him the doctor of death, right? But now I see where Canada and first world places are offering assisted suicide. I don't know what type of BS is that. All right? You see it, right?
Yeah.
They're offering assisted suicide to homeless people, et cetera, et cetera. But
not just homeless people. There was a girl, I do read a lot, and I do keep up with a lot of things.
But I slow down on reading, Dr. D, for psychological reasons.
So a young lady, for depression, when people are depressed or they have mental health illnesses and they try to hurt themselves, we isolate them so they can't hurt themselves. But now, some forms of this modern medicine, I just think there's some people who have power that shouldn't have power, are introducing things that they know are wrong for whatever reason that they're doing it for. But
it's just based on your level of consciousness, Dr. D. I've been reading over the years, and it's all piled up. But it's something that slipped my mind that I really wanted to say. But I just hope it would come back before I hang up. But the thing is, you in the medical industry, people should have, what I'm saying is, some people neglect their own health, but for what I'm saying is why I said prevention. When I look at the foods that we put into our bodies, I am 59 years old today, right? Trying to catch up with your Grammy, right? But of course, I won't reach that, right? So my Grammy died at age 96. And so she would have reached 100, maybe if she wasn't taking so much Tylenol and Advil. I was trying to get her to stop. You understand me? And Voltaren and these things. And she was very healthy all of her life. And so these things actually...
Well, she made it to 96. And I'll say my grandmother has been on blood pressure medication for a long time. She is very consistent. I would say...
The thing is with the blood pressure medication, Dr. D, it maybe, at that age, you would have, certain dysfunctions as far as the arterial walls becoming more, losing elasticity. It's certain things that would happen naturally as we age, right? And, Grammy, they eat a lot of things that they consume a lot of whole foods. And what I noticed with my Grammy, she never really consumed a lot of food at one time. And so I'm like that. I was out this morning for breakfast with my daughter, and they gave me a whole bowl of stew fish, and it was so good. I didn't want to eat all, but I actually ate it. And I'm not used to consuming or gormandizing a whole lot of food one time. You understand? That's just something I have programmed myself. I don't know why, but that's just how I program myself. And I avoid a lot of foods. But you still have perfect in that we know that how they have adjusted the food supply chain et cetera, and what's going on in the world. A lot of information is being suppressed. Even a famous retailer said that he is selling nothing that's banned, which, and I know it's incorrect because something could be banned in Europe but still be in America, but you're saying it's not banned, but we know it's banned. And so when I look at where we're headed, it's really like we're all being duped. And as far as the hospital, the government could really do better because it really is an inglorious feeling when you go there, and it really sinks you in a deep depression. It makes it worse, coupled with the fact that some of the medical staff, they really kind of show contempt, like, you know what I mean? And then the place is so small, even with the clinics, the government they are filling up the place with migrants, but they're not willing to innovate in the healthcare system. So it's like they selling us to the slaughter in so much words, because everything is you're being denied time for surgery. And so when you rush a surgery, right? When you rush a surgery, it's more deadlier because there is no preparation. So let's say I have this particular condition. So when time comes, if I have an emergency, I go to A&E and they rush me into surgery. I stand a better chance. I stand a worse chance than if it was a elective surgery. You understand what I'm saying, Dr. D? So it's still
you bring up a really good point when you talk about immigration, and it's one of my issues with having illegal immigration is it's very hard to plan services for the population with a large part of your population.
The people are taking over. I saw a Haitian lady. She just came here.
They're undocumented, right? So you're saying there's... You're saying that there's less than 400,000 Bahamians, but if you have another 50, 80, 100,000 immigrants that you're not accounting for...
And so that brings up the point, Dr. D. I don't really want to hear what the people who are putting out a lot of false narratives during the pandemic. So, and then countries who were not adhering or who were not a part of the WHO, they fared better. So the WHO, to me, it's like a global dictatorship, totalized healthcare system for me. They say things, and we know who are controlling them because we know who fund them, but the average person don't know. So they go along as the WHO and the FDA, and you could go and read books that can discredit these people and show that they're really not what they're pretending to be. All right, it's just sad that the world is heading down this particular model. When we see where they're driving us, there was an article that somebody posted on the chat, and it was about pneumonia, saying that most of the people that had COVID died from pneumonia. But when I had seen that over and over on the radio as a non-pundit, that pneumonia is a secondary infection to COVID-19, and I had proof because my cousin, every time they say they test him, he had pneumonia, but he never tested positive for COVID, but he died. All right, and he was on oxygen. I don't think he was intubated. So even as I go back in Dr. Eleanor McBain's book, which was written in the 1930s, but she lived during the 1918 flu scandemic, and she said that when they did autopsy on about almost 1,000 corpses, they found out that the causes of death were pneumonia and not influenza. So what I'm saying is I was correct, and so the topic was mystery. This was not a mystery. This was something that should be known, whether it was the pneumonia was viral, bacterial, or fungal, which will probably be bacterial or viral. But this is just common sense, Dr. D. It has nothing to do with who's smart or who believes there's this and that. This is just about bringing out the truth to people. And if Dr. Eleanor McBain disclosed this from 1918, why is it that they're still lying to the public about influenza and the relationship with pneumonia? We know flu in the lungs basically is pneumonia. This is what the studies showed. People are dying from myocarditis post-increase the population in the world. Who would I target? The people who are most likely to have sex and have children, Dr. D. All right?
Yeah,
so this is nothing new. So we're all in a scary place. And it's scary for somebody like me at my age with young children. And there's really no healthcare system you have to be in.
Take it easy, man, and just, remember that, all is not lost. I think there's
but you know why? All is not lost through God. You see, that's who I rely on. But what I'm saying is we have to realize as a people that we are being neglected, grossly neglected. The hospital is an inglorious place when you go there. It shouldn't be like that for a small country with a small population like ours, Dr. D. Bless up. Have a good night.
I agree, definitely. We have a comment from online. Why aren't hospitals and clinics built next to the beach, and not to knock on PMH, but the atmosphere there needs to be more uplifting? Yeah, for sure. And I think, I think you'll see even a better response from staffing when the environment is conducive to your job, right? So if you improve the aesthetics alone, which is something that I've always kind of thought would be a simple thing to do. I think you would have not only the staff having a better experience, but also your patients. So I think of patients perhaps more, if you think of them more like clients, or, then you would want to serve them. So I think it's the way the people in charge look at certain things. And unless that changes, it's going to be really, really hard to see the type of changes that we need. So let me just quickly go through this list because we're not going to get through all of this, but I'm thankful that we do have some callers that came in. But just like a little bit about Singapore, they do have like a insurance type of thing where everyone has to have a form of insurance. So that's really, really important, but they do take a big chunk of your salary for that. So I don't know, sometimes I think we're a bit socialist as our country because people don't really want to pay for things, but it's hard when, the pay and the wages is kind of different. So I think we have to work on just kind of expanding our economy so that people could afford things, and then building up our infrastructure as much as we can through those different processes, and then coming to a medium where we start to merge those things. A lot of these countries did not get there in a day. It took years and years for them to develop themselves in this particular way. But Singapore, which is kind of similar to us, public healthcare is funded mostly by taxes, which only cover about 1/4 of the total health costs, and then individuals and their employers pay for the rest in the form of mandatory life insurance. So you see a lot of these talk mandatory life insurance. So people aren't going into any kind of system where they're having to come out of pocket for a lot of this money. So the government supports a part of it. And then they all have some form of health insurance. So if they go to the government facilities, that pays for from their insurance. And this kind of makes it so that both private and public healthcare are both pretty good, and probably just like gives you more options and choices to do that. And they have two different mechanisms, MediShield and MediSave. It sounds kind of like the American system a little bit. So that's MediShield for big expenses. Singaporeans can access their MediShield Life, a basic health insurance scheme that all permanent residents and citizens use to pay large bills, as well as costly outpatient treatments like kidney dialysis, and those seeking to top up on their MediShield plans can purchase private integrated insurance. So on top of the basic insurance that the government provides, there's also, you can get private insurance. And then MediSave, this is a mandatory savings plan that consumes about 8 to 10.5% of an employee's monthly salary. So it is quite costly. And so that there in itself provides them multiple ways to kind of pay for stuff, and that they can use their MediSave accounts to pay for some types of routine care and those of their immediate family members. And what I saw is just that what they did is, because the government does subsidize things, they kind of have a chart where you can see how much you would pay if you went to a public hospital that's subsidized, and then if it's an unsubsidized public hospital or institution where you would need some kind of insurance, and then if you went to a private hospital. So although the people still have a public hospital that's subsidized, it's still a lot cheaper than the private care. So to take care of like a blocked heart vessel in their public hospital system, it would be between about $6,000 to $9,000. In an unsubsidized public hospital, it would be $16,000 to $26,000, but privately that can cost almost $50,000. So you can see they're still paying. They're not paying what they would pay otherwise. Comments online. Good evening. This is coming from D'Amico Bain. Singapore makes healthcare a top priority for their citizens. We need a government that loves their citizens like that. Yes, quite correct. The other thing is there is some cost to that, so we have to figure out how to pay for that. And are Bahamians willing to pay more for the services that they want? I think it has to be a mixture of, expanding the Bahamian economy so people are in a better position, as well as the government positioning itself to help the people in creating the infrastructure that would make sense. Also, one more comment, Citizens for a Better Commonwealth, Bahamas, Dr. D. Archer. There was, there was this doctor, and something that he said really made us think. Let's say that you have a headache. Is taking a pill really the solution? What is that headache about? A bigger problem, but all the pills does is turn off the headache. And we wonder why people just all of a sudden pass away. Well, that's why it's important. The caller talked about preventative health. Preventative health is very important because it allows you to screen for problems that you may not realize until you have a sign or a symptom. Signs or symptoms are not a good thing, because by the time you're having a sign or a symptom like a headache or some other problem, it's probably later in the stage of whatever it is, number one. So it's good to get your annual every year. We encourage our patients to come and get their annual physicals, because that just allows us to kind of screen for some of the basic things that could be a problem. Also, if you're consistently having a problem, pill popping, I agree, it's not going to be your number one. You got to come in. Sometimes people are having high blood pressure. I've even had patients who've had just cholesterol issues, and once we got rid of their cholesterol issues, they stopped having headaches. So that may have meant that they were having, a lot of cholesterol buildup in their vessels or stuff like that. So it's good to go in, and if things are consistently happening over time, don't wait on it. Get it checked. At least have an idea of what's going on inside of you, because it's really hard to tell sometimes by just looking. Last comment before we go. Singapore was a sovereign wealth fund for their people, funded by their natural resources. They're for all citizens. Yeah, so Singapore does have a lot of systems in place that are working a lot better than ours. We've had problems implementing our sovereign wealth fund, and all of the plans that they've kind of put forward were not in our best interest. So we do need people who are going to put those types of things in place that are going to be for a better interest, and things like healthcare, because Bahamians struggle with that. We have a lot of chronic disease, so we need a lot of healthcare maintenance, education, preventative care, if we're going to have a future where our healthcare system isn't going to be so costly. So we're at the end of the show. I want to thank everybody for listening, those of you online and those of you on Guardian Radio 96.9. Thank you for joining me, Dr. G, on the Doctors In for all things health, wellness, and pertain to the Bahamian Society. We didn't get through our list, so maybe I will finish that up next week, but something to think about, systems in the world, and how do we in the Bahamas get to one of those spots? I think we can. We're a small nation, and we have a lot of resources that we're not tapping into, and I think it's possible. So have a good week, and I'll see you next week, Tuesday at 6:30 on Guardian Radio 96.9. Good night.